This is just Russell McCluskey here with Recalibrate Physical Therapy and Dr. Ben Costa with Telehealth Physio. We'll just give a little bit brief introduction about who each of us are, how we know each other, and then what we plan on doing today is kind of getting into the background of telehealth, what it is, what got us interested in it, how we see it addressing some problems in the healthcare system that could be better addressed much more conveniently and cheaper with telehealth, and many other things that we'll get into. So briefly, my name is Russell McCluskey. I graduated from Regis University with Dr. Ben over there, and ever since then, I've been working in the orthopedic and sports medicine realm for the last 5 or 6 years. I have an extensive background in manual therapy and a long history of a passion of treating runners and working with the active adult population. And recently now I've started Recalibrate Physical Therapy, which is an out-of-network practice primarily based in Salt Lake City, where we focus primarily on runners and the active adults. And we have now incorporated telehealth for the last few months, starting to see some really good results. And I'm really kind of excited about where the future lies for telehealth in the realm of providing high-quality healthcare solutions to pretty much everybody, as long as they have internet. And luckily in the US, if you live in the US, there's a high chance that you have internet. So no matter where you are, you can receive high quality care. So that's a little bit about me. And then Mr. Ben, tell us a little bit about yourself, who you are, and all that.
Yeah, so my name is Dr. Benjamin Costa, and I live in the Bay Area. I live in Marin, and I work in an orthopedic outpatient population treating really people with all different types of injury conditions, ranging from as young as 6th grade really to as old as the people in their 90s. So I really see a wide array and spectrum of people and injuries. And yeah, Russell and I, we know each other going all the way back to our grad school days at Regis University PT school. And like Russell, been practicing for roughly the last 5 years. And over the last 5 years, I really have enjoyed working with student athletes. So I really enjoy working with teenagers and college kids with their sports-related injuries. And I've also really enjoyed getting the chance to now hone my skill working with the skiing population. I got a chance to work and still work part-time for a clinic where one of the doctors that's associated with our clinic is the head surgeon for the U.S. freestyle ski team. And so I took this position, this clinic initially to get a chance to build a working relationship with him and get a chance to work more with professional and recreational skiers. And I've loved getting the chance to work with skiers. So kind of like how Russ, you like to work with runners, I really enjoy getting the chance to work with skiers.
Yeah, happy to hear that. So with telehealth physio or telephysio PT, is that kind of the population you're trying to target because of what you just mentioned? That's just your passion there?
So now, yeah, so I started kind of like every other physical therapist does in the traditional kind of clinic, brick and mortar setting. And I just kind of I got tired of it. And I found that there's a population of people out there that are not being seen or heard as much as I'd like, as much as I'd like. And I find that a lot of the times, the people that tend to be a little bit marginalized are actually the student athletes, oddly enough. I know that might sound a little counterintuitive, but I find that for a lot of the student athletes, it's so tough for them to schedule based on their school hours, their sport activities, and any sort of extracurricular commitments that they have. It's so tough to get them into the clinic. And what I often hear from the front desk when the parents are trying to schedule is, "Oh, my kid can only come in at 7 a.m. or they can only come at 5:30. It's like it's only 2 time slots they can come in." And I didn't like how tough it was for that population to be seen. So I started, to get into this telehealth industry because I thought it'd make it a lot more convenient for student athletes to be seen at times and at locations that are easier for them. So, they can be seen really from anywhere. So that's how my journey into telehealth got started. And as I'm doing it now more, I realize that it's not just student athletes that benefit from telehealth, right?
Absolutely.
Um, I don't see an age or an injury right now that can't benefit from telehealth. And what started off as kind of trying to niche down into a certain population to work with, I've realized has kind of grown and expanded to really include so many different types of people. And I think, you know, right now the situation that we're dealing with across the world with the coronavirus epidemic has really thrusted telehealth into the main spotlight. And now people are asking about it, they're talking about it, or they're looking for other ways to access healthcare, and they're not quite sure how to do it. So I'm really glad that you and I are having this meeting to give people the opportunity to know what's available out there, how to access it, and to know that it can be just as successful as hands-on or face-to-face rehabilitation.
Absolutely. I'm happy you brought that up because I couldn't agree more that telehealth, it, it, it starts to address a big need that healthcare can't really address as currently stated. And one of those issues that you mentioned is time. I mean, people are busier now more than ever. I mean, being able, if you have a kid, like with the athletes that you're working with, that requires the mom or the dad to take off time from their work, go pick up their child, come to a clinic, take the kid back to school, and then back to work. I mean, that seems to be, I mean, that's one way of doing it, but now with the advent of telehealth, that seems like the old way of doing it and super inefficient. So now instead of having to do all those different trips, take off a couple hours, take the kid out of school, they can simply hop onto a video call with you pretty much anywhere as long as they have internet. And that's what's really great about telehealth is it's actually starting to address some of the problems that are currently being unmet. So like all things in the world, there's always some problems that start to develop, and then over time solutions start to be implemented. And like you mentioned, the unfortunate event of the coronavirus and the pandemic and where everyone's quarantined and being forced home, it's not a fun time, but it has also expedited the transition and the reality of how important telehealth, telephysical therapy, and really honestly any industry, how much can actually be provided through live video without quality being sacrificed, which I found to
Yeah.
be super fascinating because everyone's been watching videos forever on YouTube pre-recorded, and for some reason with healthcare, people are a little bit apprehensive with a live interaction, but they're super comfortable with a pre-recorded video walking people through exercises. So that's kind of fascinating.
Yes. Yeah. Why do you think that is? Why is it that it's why do you think that the notion of telehealth it's yeah, like you said, the coronavirus has brought it into the spotlight, but why do you think it's taken so long for this concept of telehealth to make its way into, you know, kind of now mainstream conversation?
Yeah, it's a good question and definitely multifaceted. To me, one of the things that comes to mind for me on why that took so long is in general, healthcare is kind of the hush hush scenario where there's so many guardrails behind what type of health condition you're dealing with. So it's almost like that secretive thing that people like kind of want to hold to themselves. And so instead of having a live interaction where they might not trust the other individual, just the idea of having someone live coming into them may be a little bit new, and because it's new makes them a little more apprehensive. Whereas with YouTube, you can still get some video demonstration, but you don't have that added unknown of having someone live on the other side of the video. So to me, that's probably one of the biggest barriers. But just like YouTube, when it first came out, people were against looking at YouTube and they didn't think there was any value in it. They didn't think you could learn anything through video. So now obviously we're 10 years into that experience, if not more, and YouTube University is a real thing. So I think as
Yeah.
people get more comfortable with video, now telehealth comes into play because YouTube kind of set the standard, but now live video is kind of raising the bar a little bit, so you can get live dialogue. So I think it's just going to take a little bit of time for people to see that it's actually a real thing before they get comfortable. And then, just like all things, after we get past the early adopting phase, then a large portion will get into it, and then it's normalized. So I think that's only a matter of time.
Yeah, I agree. I think the work culture in a lot of different industries is very video based, whether it's meetings. So there already is a large comfort, I think, with people using video based conferencing. And I only see that spilling, outwards from, the other industries in towards all demographics feeling comfortable with using technology like this to access healthcare. I think young people are really great with technology, and I think now there's going to be a push for older people to learn technology. And really, this actually isn't even that hard, right? Like, all it is just downloading an app, sending a link to a person, and having them click on that link. And it's pretty simple. It's almost like, I think it took me like 3 clicks, from opening up my computer to get into my email, to clicking on your link, to like linking up with you in this format. So I think the steps to get into it are super easy. Now that's provided that you have the luxury of the availability of a computer or iPad or iPhone that has camera. But telehealth extends just beyond video, right?
Yep.
It's not just video. It can be other forms of communication, right? So it can be audio. And there's so many different aspects to it that allow you to be anywhere, and to access from so many different types of technology or platforms, that there is a platform that's probably comfortable for everyone that they can use.
Yeah, and like, just to build on that, with everything you just mentioned, maybe this is a good segue into what is telehealth, what is online physical therapy, like what does that mean to you, and how do you define it, and what is telehealth? What does that mean?
Yeah, so I view telehealth, what used to be called telemedicine, that's now kind of been reworded to telehealth because it incorporates all really healthcare professions that can use remote-based services to deliver care. Telehealth is really that broad umbrella term to refer to any sort of delivery of education, awareness, interventions, counseling, really any form of treatment or to people remotely. And whether it's video, audio, whether it's live like we're doing right now, or whether it's inputting the data and then sending it out so that people can then access it at times that are more convenient for them, right? But what you call like synchronous versus asynchronous delivery of information, right? It can be store and forward, or it can be live like we're doing right now. And it just makes it so much easier for people.
Absolutely. And since you've been doing that, and Telephysio is 100% telehealth, if I understand correctly, where have you seen some of the biggest benefits, or I guess better stated, the clients that you're seeing, what type of feedback are you getting about telehealth from them?
Yeah, the feedback is what I was hoping it would be, which is that it's super convenient for them, right? That they can schedule that. So I schedule in the evenings, on the weekends, right? Times that are a little more convenient for like students or working people. And what I hear a lot from them that is so nice to not have to leave work early, not have to take school or other, take time away from school or other commitments to have to drive to a physical location that might be out of the way for them. Instead, they can go to where they are comfortable and receive care. And so that's the big feedback I get from them, is how convenient and how almost like a luxurious service it is to kind of do it where they are, kind of meet them where they are, instead of having them meet where we are, kind of flipping the script, flipping the table. And people really, really like that. And they really like, non-traditional hours. They like evening times, and they like weekends. And really, traditional clinics are only open Monday through Friday. And people in the clinic all the time would ask, if you guys were open on a Saturday, that would be great. I'd love to bring my kid by on a Saturday. And I always hate telling them, like, I'm sorry, we don't offer that. And not only do we not offer that, but no one in the area really offers that. So having availability during non-traditional hours, I think, is really helpful for people getting into telehealth. It helps to lower that barrier.
Yeah, it seems like it totally removes pretty much all barriers to entry to high quality solutions. I mean, you don't have to take time off. You don't have to find a babysitter. You don't have to take time away from your family. And like you said, healthcare, like all our businesses, has typical business hours, but due to active lifestyles, the times in which people can actually receive the care doesn't always fall within those times. Like with the population that I work with, runners, the running population, myself included as a runner, is notorious for never wanting to forego my long training run or really any training. So if I have to take an hour or 30 minutes to go drive to a clinic, do a session for 30 minutes to an hour, drive back home, that eats into my training time. And with only so much time in a day, an hour, hour and a half, where an hour of that is travel time, eats into the training. And so I've actually seen that in my population with the runners, where what they're seeing is the biggest benefit is they can now actually fit in the care that they need instead of just ignoring it until they crash and burn 2, 3, 4 months into their running season, which most runners tend to do. It just brings it right to them. And you can actually plan your healthcare around your lifestyle instead of getting rid of your lifestyle to get healthcare. It seems to be, this allows us to flip that script as well, where healthcare seemed to be this pie in the sky thing that you could potentially get if you had the luxury of time. But now with online physical therapy and telehealth, no, you can actually now bring that in, and it becomes a part of your lifestyle.
So in addition to that benefit of telehealth, right, in terms of the convenience and the accessibility that people love about it, what else are you finding in terms of the other benefits people get from it in terms of like an outcomes perspective? Because we all really, all we're looking for is outcomes, right? Like,
Yep.
Sure, I can kind of market what I do in terms of the tools that I have, but really it's the outcomes that you and I are looking for when we're injured, as well as other people. So what have you found when working with your clientele in terms of the outcomes with using telehealth?
Yeah, it's a great question. And quite honestly, the feedback that I keep getting and that I've seen clinically with it is you can still get the same outcomes with telehealth, because the services and the expertise that I or you or any other skilled therapist can provide isn't immediately taken away just because we're not in person. So the clients that I've worked with, they consistently mention how surprised they are at the quality of care they can still receive through video. They weren't quite sure what to expect, but every time when we're done, they're always astonished by, wow, I didn't realize how in-depth you could truly get. I didn't expect to be able to have you correct X exercise the way you did. I had no idea that you could truly be as thorough as you were, because I've only experienced in-person therapy. Have you had the same type of experience with that?
Yeah, I find that when people choose to sign up for telehealth, they are foregoing already the traditional model of PT by, one, doing it online, but two, sacrificing a lot of things that people come to know about physical therapy, which is a lot of passive type of care, like massage and heat and electrical stimulation and ultrasound, and kind of relying on the structure of going to a place to receive treatment. What I find is that now the mentality has shifted as well. So if they're coming on to online or telehealth physical therapy, they're much already more motivated and already more, it has to be more of an active approach to their treatment. And I always find that active approaches to treatment yield quicker results. So they're more active because all they're doing are things that I'm instructing them to do. So they have to do it themselves. They don't rely on my hands to do it. Now, if a hands-on treatment is needed, then it's always appropriate, and you have to kind of know when to refer out to a local therapist in their area if they need a hands-on treatment. But for the most part, it's so active on their part that the adherence improves. the diligence to their program improves, and you're seeing quick results, just as quick as you'd be in a clinic.
Yep.
But now, because it's more active, it almost is more self-empowering, right?
Mm-hmm.
Less of a dependency on someone else and more empowering, knowing that you did it yourself. And I think that yields some really long-term results and is more sustainable that way.
Yeah, I'm happy you touched on that. That's just a really good point as far as encouraging the client to, by the time they're done with your care, that they've also developed the habit structure to continue these healthy habits going forward, to not only keep them healthy, but try to minimize injury risk going forward as well. And like you said, empowering them as PTs at the end of the day, that's truly the outcome that we're hopefully looking for. You know, because you can go one of two ways. You can create an environment to where they're 100% dependent on you for everything, and you can go the other way. So there's likely in that middle ground where you want to be that support structure for them to help them through the periods that they need help with and coach them through no matter what they need coaching with, but also allow them to increase their self-efficacy so they can confidently get back to, in your case, skiing, and in my case, running, hiking, and all that. I want them to get to a point to where they can handle that on their own, but they also know if something comes up, if there's an issue, that they can reach out directly and we can continue to coach them as they continue to be empowered afterwards. I'm really happy you brought that up.
Yeah, and kind of, I mean, the list of benefits, I think, can just, as we talked about, for me, it just continues to like get longer and longer. I think another benefit, which I'm sure you see with your population, is the ability to give them advice immediately after an injury, right? To know if there's something more serious going on, if it brings up any red flags that require an immediate referral to them to go elsewhere, or to let them know that, hey, you're safe to continue with conservative treatment or with physical therapy. I think getting to them online allows us to get to them and in front of them much sooner than they would be going to a clinic. We can really serve as more as that first line of defense after an injury, and can really provide them with the education they need, the information they need to know if they need the conservative route or if they need to go and seek a referral from another healthcare practitioner.
Yeah, absolutely. And obviously with our skill set, even through video, you can pretty quickly determine which individual may need to be referred out. And as we both know, the likelihood of that's extremely low, but it does happen. The vast majority of injuries can be successfully treated with our skill set, but hey, part of that is recognizing when it's not and getting them out. And you can definitely do that through video.
Yeah. What are some of the questions you come across from people who are looking to learn more about telehealth, or who have come across you and are interested in your services? And what are some of the questions they ask regarding telehealth, and how do you kind of help educate them on it?
Yeah, it's a very good question. The most common questions that I get around telehealth, honestly, are, do I have to download anything? What type of security is on this? And can I just use it on a laptop or tablet? Because luckily with the running community, they tend to, at least as far as I've seen, be already on board with telehealth. So really their only questions are, how do you get it to me and what do I need to use? I'm sure in different populations, there may be a little bit more problems along with that, but those are the biggest questions that I get is, are you just going to send me an email? Do you call me? Do I have to click a link? What happens? How does this work? And so that's really the majority of the questions I get. Do you have anything specific there?
I get, from some people when I work in the part-time in the clinic, and I talk about telehealth, and I speak to it kind of like we're speaking about it now, and they say, oh, well, that means you won't have your hands on me. What does that mean? Is that going to be just as good through the computer as opposed to being face to face? And then I remind them that over the last 5 visits, I haven't laid a hand on them once. Right. And then they're kind of reminded that, oh, that's right. I guess this whole thing could have been done through telehealth. It all has been just you're listening to what is going on and then tailoring and modifying things through both what I say and both how I move.
Yep.
To achieve outcomes. And when you kind of paint it in that picture, they're always really surprised that, oh, actually, yeah, I guess you didn't need to put your hands on them.
Yeah, absolutely. And I'm actually glad you brought that up because I've gotten that a few times as well. With that, so outside of the running community, the active community, and the athletes that you're treating, the skiers, do you think there is a certain type of diagnosis that telehealth can't handle? Or said better, what type of diagnoses can be successfully handled through telehealth?
That's a good question. In my opinion, I haven't come across a musculoskeletal condition yet. When I say musculoskeletal, the common orthopedic injuries that you see, knee sprains, low back pain, neck pain, shoulder pain, rotator cuff, heel pain, all these different common musculoskeletal orthopedic injuries that you see. I haven't come across one yet that can't be treated with telehealth. And that's because I try and replace what they would need hands-on work with techniques they can implement themselves to generate the same effect of what the hands-on would do to the best of the abilities you can. So I haven't come across a condition that I can't see. I'm trying to think here. No, I haven't had to turn anyone away or refer them to anyone else. And then, yeah, how about you? Have you come across something you don't think you could see or could treat or be effective with?
Just a little bit, but quite honestly, it's only due to patient preference. But like you were saying, all orthopedic and sports-related injuries, and you defined it well as far as the stuff people would know about, plantar fasciitis, neck pain, shoulder pain, all that can definitely be successfully handled through telehealth. What I have noticed is some people just want that last little bit where they do really prefer the hands-on treatment. And if we get to a point in our plan of care where what they're really suggesting to me now is, hey, I'm actually doing really well, but I really do prefer X treatment, then that would be the only time where I'd say, well, obviously with telehealth, I can't do any hands-on. So I personally do mobile physical therapy, and well, then I can travel to their homes and provide any of the hands-on services that they would be looking for. But from a pure diagnosis standpoint, I've had zero issues on being able to effectively treat it just like I would in the clinic. I've found that patient education has become one of the primary things that I utilize as a clinician anyways, and through telehealth, I can obviously walk them through everything I need them to do to be able to figure out what's going on, and then I can really take the time to educate them on what's happening. And I found that actually gets really good results, and it goes back a little bit to what you were mentioning as far as empowering the individual, to take them away from a fear of pain, which is a very rational component of any injury. But by and large, all that takes is some type of reassurance that nothing serious is wrong, which we do within our screens. And then from there, we just get going. And that's kind of how I've been utilizing that and seeing that play out.
Yes. Yeah. There's some good points I want to touch on there with you. So, I mean, the one really nice thing about your business is that you provide both, right? So you provide the telehealth component as well as when you find that someone needs hands-on, you provide also a mobile service, which is so great. So someone like myself who just does online, if I found that the person needs hands-on, I would refer them out to someone like you to continue to make sure that they get the outcomes that they want. And I'd say, I would expand it a little bit, not just in terms of musculoskeletal conditions, but also talking about conservative versus surgery. I think maybe one of the lesser, maybe counterintuitive, lesser known benefits of physical therapy is that it can also be used to address surgical injuries. So I think people, even with ACL tears early on, right? A lot of it is still them doing the work from a range of motion perspective. And even in the prescribing the exercise, I think you can still be effective with doing it online. So I think even with some surgery cases, some shoulder surgeries, not necessarily a rotator cuff tear, but maybe some subacromial impingement surgeries. I think there can be a case made that not just conservative not just non-surgical cases, but also surgical cases can be treated effectively with telehealth or online physical therapy.
Absolutely. You definitely bring up a good point, especially with some examples of, say, ACL or even total knee reconstructions, total hip reconstructions. Honestly, even in-person therapy for those type of surgical cases, they're all exercise based. So very rarely in any of those do you need manual unless there's some type of restriction that you need to work out. But by and large, those are exercise based and active approach recoveries. And especially with the active population, ACL injuries tend to happen in that mid to late 20s because they're sending it on the slopes where you're at or where I'm at here in Salt Lake, and they might be living by themselves. So if they have a surgical case, they have an ACL tear, now they can't drive. That could be another barrier. And like you mentioned, with those specific surgical cases, telehealth is again the answer. They don't have to drive anywhere, and you can still walk them through, because with all those surgeries, the total knees, total hips, ACLs, honestly, it's the first 4 to 6 weeks you're almost trying to do damage mitigation and prevent them from re-injuring things while strengthening up and stabilizing things along the way to get the best long-term outcomes.
Yeah, you bring up a great point. I think a lot of people wouldn't imagine that knee replacements and hip replacements could be something you could rehab online. But I especially think about hip replacements. I mean, hip replacements, not only are they, especially with the different approaches they have for the surgery these days, but those rehabs are so quick. I don't think I've hardly laid a hand on a hip replacement patient. Now, like you said, barring any sort of unforeseen developments following the surgery or any sort of any other things that would require hands-on, it can't all be done. But by and large, even surgical cases can be done with online physical therapy.
Absolutely. And with those total hips, what's interesting about those is, I mean, I'm seeing in my local area here that sometimes they're not even prescribed physical therapy. So, which, it is what it is, but it's also like, if that's the case and they tend to do pretty well, what's the point of going into a clinic that will likely recommend 2 to 3 times a week for 10 to 12 weeks, when in reality, barring any unforeseen consequences or things that aren't normal, you likely only need 4 to 6 sessions spread out to make sure all the key things are happening and you point them in the right direction on how to stay strong, healthy, and mobile.
I think what's interesting is the people who tend to get the hip replacements and the knee replacement surgeries are going to be a slightly older population.
Yep.
And it's the kind of population that might not know that telehealth or online physical therapy exists.
Yeah.
We kind of, these services are kind of more known amongst the younger populations who are already using technology a lot, or and the working age people. But even the older people, right, who get these kind of surgeries should know that this is a format, this is a platform that can work well for you.
Absolutely. And as far as the older population, I'll say that loosely here because I don't even know where that starts, where that ends. I don't want to get in that. But my mom, for example, is not tech savvy. I'll put it that way. And a couple months ago, she had an injury prop up after a vacation she went on where she did a lot of walking. She was on her feet quite a bit. And it was right when I was just getting telehealth going. And so I actually offered it to her. And again, she's not tech savvy at all. She is fearful of using computers. She legitimately will look at something. If she doesn't understand it in 2 seconds, she throws it away. So I was a little bit apprehensive on doing some telehealth with her, but I was like, you know what? I'm going to send this over to her, because if my mom can figure this out, then anybody can figure this out. And to my surprise, she was able to click in, find the email, click on the link, pop in, and the only thing I had to walk her through was how to turn on the camera to her laptop, because it just wasn't turned on. But even in that older population, or the people that may not be tech savvy, it's super easy. It is so easy to get.
I I love personal examples like that. My mom's one of those people who, if you were, if she was on your schedule of people to see, you kind of take a big deep breath, because you're like, this is going to be a long session, because she loves to ask questions. And I think asking questions is super important, because the more opportunities we can get to answer questions, the better. Like you had talked about before, how important education is.
Yep.
She would really, she's the type of patient who would really drain your energy, both mentally and physically, because of the type of questions she has. And you would think, a person like her, who really enjoys the interaction that would traditionally be face-to-face in person, can transfer over online and still, achieve the objectives or the expectations she had coming in to a physical therapy session. I mean, that easily converted her when she was dealing with a foot pain that she had from cycling. So I love examples like that of older people who you actually, it doesn't take much effort to show them the benefits of this, because once you do, they're pretty hooked.
Absolutely. And when I treated my mom, I told her I was going to record it just so I could study and learn the process a little bit more. And to my surprise, afterwards, she hounded me for a week on when I was going to send that recording to her, so she could review the session and review some of the key concepts we went over, which I thought fascinating, because again, she's not tech savvy. But then when I told her it was recorded and we talked about a lot of good things, educated her on some key concepts, she really wanted that recording so that she wouldn't forget it, which I also hear quite a bit, that, you go into your physical therapist, your physician, your chiropractor, whoever, and they finally said the one or two sentences that made everything make sense to you. And that person, like, you even tell them in the clinic or on the call, where you're like, hey, do you want me to write that down for you? Like, no, I'll remember this, no problem. And then next week they come in and they totally forgot it, so you have to tell them again, or they tell you that they got home and immediately forgot. So that's another benefit of the telehealth that I was just thinking about, is having the ability to record whatever the patient seems to value and then send it over to them so they can keep that for themselves for further review however they want.
That's such a great point. That's such a great benefit of telehealth, is the ability to record these sessions to use as educational material for them that they'll always have. They can always go back and review the tape, like you said, to find that maybe that one sentence that really resonated with them. And once again, to touch on the education part, education is so important. That's something that we can do so well over this platform. I mean, even when working in a clinic, right, one of the highest reimbursing codes from insurance companies is patient education, patient counseling. It continues to go up the list of one of the higher reimbursing codes. And what continues to get lower? Manual therapy and all the other forms of passive modalities. So
Yep.
I really think that not only are we recognizing education as a super important category to be put into people's plan of care, but also, the other big insurance companies, right, the ones that reimburse, they see those same things. And on here, we're reduced to having, we're reduced in a way, right? We don't have the physical touch. We have to really rely on other skill sets to be successful. And I think one skill set that therapists who do online physical therapy have is the ability to listen and the ability to educate. And that can produce so many great results for people.
Yeah, 100%. And even with that recording that we were just talking about too, is I've had some people apprehensive about having the recording. Sorry to jump back a little bit, but they didn't want the full recording because they're like, I don't know what I'm going to do with an hour video, and I don't want to have to go back and review all this. But that's okay, because I've been able to offer to them, and I'm sure you have as well. It's like, oh, no problem. Like, if you want me to record the exercise I just gave you, or you want me to record the explanation I just gave you, and then that's it. It's a 2-minute clip or a 4-minute clip of whatever you found valuable. We can do that as well. So it's not like the individual can only get the entire hour file, which quite honestly is a little bit of a burden to go back and review. You can chop it down into the pieces that they need, and that could be part of their home program.
That, this conversation kind of wants me to take it into and segue into a nice direction of, who are other people that could benefit from online physical therapy. And I think even that person who is really numbers driven, who really likes to have some sort of physical evidence to justify the progress or maybe lack thereof progress that they're making, right? That's one question they have is, how in this platform can you show me numbers or objectively that I'm making progress? And with telehealth, we can be just as effective in doing things like measuring joint range of motion that you would do in the clinic.
Yep.
And based on maybe the therapist's ability to cue the client, you can have them do things like measuring swelling, right?
Yeah.
Doing self-assisted manual muscle testing in isometric positions, like things that you will have done to you in the clinic to gather evidence, to gather information about your baseline level of physical performance, physical limitations, right? You can do those same things on telehealth to provide them with the numbers they need to feel comfortable and confident that we can track this progress over time. We have something to go off of.
Absolutely. Excellent point. And with my population, with runners, they tend to want to have a video demonstration, quite honestly, of where they're starting now. If it's, say, a biomechanical thing, they want to have a video demonstration of now and a clear target of, okay, if this is where I'm at and that's not what we want, what's the end goal? What's that going to look like, and how long do you expect it to be there? But they want to be able to have that video to go back to compare so they can actually see the improvement that we're working on. So like you said, you can get range of motion measurements, other objective findings that we typically look at, and you can also use performance measurements and just biomechanical analysis that they have on their own. And again, in the running population, they tend to like that. I'm not sure if that applies to all populations, but
I think it applies to a lot of populations, because I think back to baseball pitchers, right?
Yep.
A lot of times they want to show me a video of how they're throwing, right? So already in a clinic setting, they're really just showing me videos that they can just show me online that can help to give me information about how to treat their injury. And it goes over a lot of sports. Running, right? In the clinic, you do a lot of video analysis of people's running mechanics.
Yep.
Why couldn't you just do that online already, where they send you an uploaded video that you can review with them right then and there, and use, quite honestly, technology that's better on the computer than in person to measure joint angles and joint forces and things that can give them, quantifiable information, right? So that's, you can see it in runners, you can see it in baseball players. I see it in skiing as well. People upload and send me videos of their jump, of their takeoff and their landing mechanics on mobile courses, as well as they send me their turns to show me the angles of their knees and their hips and their back when they make turns. And so, you get so much information that you can quantify that they would typically show you in a clinic that they can just easily show you online.
Absolutely. Absolutely. And man, it's so great because we could go on and on about the benefits of telehealth and the fact that you can still provide any and maybe even more services through the computer that you could in person. But a question that I have to kind of steer this a slightly different direction is, where do you see the future of telehealth? Like, how do you see to say the next, 5 years, 10 years? What's your prognosis and dare I say prediction of the utilization of telehealth going forward?
I I see telehealth going only in the direction of onwards and upwards. I think that you and I, who've been interested in this for a while, it doesn't seem new to us. For a lot of people, it does seem new. And I think the coronavirus epidemic has slingshotted our profession of physical therapy into the future 10, 15 years ahead of where we might have been if it wasn't for this epidemic, because now it's shining a spotlight on the deficiencies of the healthcare system, healthcare delivery. So I only see healthcare as increasing in its prevalence and its frequency, going on from here. Um, I
Absolutely.
see it at yeah, yeah. What about you? What do you think?
I see the same thing. I honestly see it right now. Like I always tend to try to judge things based on where they are on a curve of like early adopting, late adopters, all that. I think right now we're in the early adopting phase, even though it's been around for quite some time. I mean, you and I know plenty of people that have been doing this for years. Um, but now it's still in that early adopting phase. So I think we're right there. But because of the coronavirus, I think that's going to transition us quickly to a large number of not only providers of all professions realizing the utility, but more importantly, it'll then normalize the concept of receiving live healthcare and live solutions to your pain and injury in your home. So I think even 5 years from now, I honestly think that's too far of a time frame. I think within the next 2 years, the amount of people that are actually asking and seeking for this service because of everything we've been talking about is going to exponentially grow. And honestly, if you're not offering services like this, I think you're actually going to be in a point where you're not serving the population as well as the needs demand.
Yeah, yeah. You see a lot of people now offering telehealth with the coronavirus, but I do think it's just a momentary offering of those kind of services. I think when the coronavirus ends, you're going to see a lot of these clinics that had an adjunct service of telehealth go right back to just doing hands-on in a clinic type of delivery.
Yep.
I and that's going to happen for a little bit, but then people are going to realize here after doing more telehealth, um, almost being forced to do telehealth because they can't leave their house, that it's so convenient, right? And who doesn't value convenience? And yet you still get the same outcomes. Like the combination, that pairing there, I just don't see that, or I see that only helping to fuel telehealth into the future, and allow it to continue going forward, picking up more steam ahead.
Yep.
Um, Even before this coronavirus, I thought that there's only upward expansion for telehealth. Um, I just see, living in the Bay Area with rent being as high as it is, for both
Yep.
residential and commercial property, it is so tough to pay rental prices for building space, for clinic space. And I just don't know if that's a very sustainable model for physical therapy, since really, you know, clinics don't make that much money. The average clinic really doesn't pour in or rake in the money. They're really just getting by. So I don't think it's a sustainable model in areas where I live in, where the prices are so high. I think it's going to have to force people to think about going in another direction, and that other direction is going to be telehealth.
Wow. Hearing you just say that, like, just made me think of something in addition to what you just said. Like, I didn't even think, I'm so happy you brought that up, of the cost to deliver services, and especially in areas that you're in where the cost of rental prices or leases for physical space is so high. Man, that just got me thinking that part of the way that brick and mortar businesses tend to find ways to pay for those leases is to do what? Likely increase the volume of care, meaning the individual goes in and the PT maybe even has a high school tech or a physical therapy assistant if they're lucky around, and the individual patient is being seen by the provider while that provider is seeing four other people. And that's one benefit we haven't even got to yet, is that with telehealth, it's 100% one-on-one personalized attention the entire time. It would be impossible to be seeing 4 different people on live video, and no one would tolerate that. So for those individuals that really value the one-on-one interaction and value their time enough that they want the professional they're paying to see to be all eyes on them and giving them the solutions they need, it's accomplished through telehealth.
Well, I think, yeah, to piggyback on what you're saying, I mean, you could do in this, what we're doing right now, multiple people in one session, but people like you and I don't want to, right?
Yeah.
We're getting away from that old school model that you see, not necessarily old school, it's still occurring in a lot of clinics, of this double booking, triple booking, quadruple booking, right? Every 15 minutes, and passing off these patients to an unlicensed rehab aide who's most likely fresh out of high school or college, and is there for the credits to get into PT school. And, you know, every therapist has gone to a clinic that's worked like that does that, you know, that sort of PT mill.
Yep.
People like you and I who are looking to break away from the old school model, adopt a new model, and do something like this, we're not looking to have as many little screens on here as possible and do 2 or 3 sessions at the 2 or 3 people at the same time. We're looking to make it more individual and more specific for that person. So while you could always do that on here, people like you and I, we're not interested in doing that. We're trying to break away from that old model and show people that doesn't need to be done. But you're right. Clinics do it because they need to generate revenue, and they need to generate the revenue to pay, to keep the lights on, to pay that monthly rent. And it's unfortunate. And it's, I wrote a blog recently, run away if your PT does these 3 things.
Oh, great.
Right. And one of those things is, if your PT routinely double books you or triple books you. I get it, every once in a while, if you have to be double booked based on people showing up at wrong times, or scheduling mishaps on our end. But if your therapist is routinely double or triple booking you just to hand you off to an aide, run away.
Absolutely.
Right?
100%.
The second thing you should be running away is if you find that the therapist is not listening to you.
Big.
Right? If you find that you're talking and they just serve to interrupt you immediately, or their head is buried in the computer, run away, right? Because they should be giving you more time and attention to have you speak and give you the floor. And the third thing is that if they rely mainly on passive forms of treatment, right? If your typical episode of care looks like massage, then heat, and then electrical stimulation, maybe some ultrasound throw in there, run away. So talk about old school models of PT, maybe think about that and want to bring that up, because I tell people, that's not how it's done anymore. You got to get away from that. And in this online forum, we can't do that. It's not possible. I can't hand you off to an aide, right? Yep. My head is not buried in the computer typing. I'm sitting here talking to you right now. And I'm not going to double book or triple book you, right? I'm not going to. So I think, those 3 things I think are so valuable that help to give online physical therapy a leg up compared to face-to-face rehab.
Yeah, and you touched on a good topic there, where if someone has had the type of physical therapy in the past where it has been primarily what you mentioned, where they come in, they get thrown on the bike for 5 or 10 minutes, they have an aide walk them through the exact same exercises for 12 weeks, and then they are thrown on heat, ice, and stim because it feels real good, and that's the session. And if someone's like, man, I don't trust PT again, because if that's what PT is, I don't want to get involved. And I don't blame them. Like you said, if those are the things you see, run. But if that's a fear, now with telehealth, that literally isn't a fear, because as you said, it's physically impossible to do that. That's actually,
yeah, exactly.
That's pretty good.
You're not going to get those treatment options. It's not an option. You have to rely on more active forms, and you have to rely on engagement and listening and talking to the person, which I find to be more rewarding than the old model that we were just ripping apart.
Yeah, I just had a funny thought of, imagine being on a telehealth session and you actually replicate one of those poor PT sessions where you're on this camera and you're like, okay, so go grab your heat pack from your fridge, put it in the microwave, throw it on your knee, and I'm just gonna like go walk in the other room and I'll be back in 10 minutes.
Yeah.
Oh man.
Yeah, they would end that meeting very quickly.
So great.
So yeah, I find that ultimately telehealth is here to stay. I don't see it going anywhere. I think it's going to see a little bit of a dip down after the coronavirus, but ultimately it's just because people need time to ramp up online services, but quality online services. Right now, they're kind of being thrown hastily together and being thrown out there for people. And really, when a lot of it right now is just phone calls, because a lot of people don't have the capabilities or the infrastructure set up to be doing something like this. Why I say infrastructure, just like the system set up to do it. Not that it requires a lot of infrastructure, but because a lot of people were thrown very quickly into this fold, a lot of therapists were thrown quickly into this fold of telehealth, they're only using the phone. And so I think you're going to see that it's going to dive down. And then when people have the time to put the energy into developing a really great online system, they're going to bring it back up, and they're going to find that people are going to gravitate towards that more than coming into a clinic. And I'm sure you'll start to see higher reimbursement rates from insurance companies as well as the government backing this, as we see right now with Medicare.
Yep.
Medicare reimbursing telehealth sessions, as well as bills being talked about in the House right now in the state of California about providing parity laws of reimbursement, yep, where insurance companies will be reimbursing the same rates for online as they would for in person. And insurance companies, quite honestly, would only do that if they saw the benefit, right? Insurance companies go based on research. They go based on outcomes and results. And so if insurance companies are going to likely reimburse online the same way they do in person, then that should be a sign to you that online physical therapy works and that they are putting more eggs into this basket, hoping to grow this side of healthcare delivery.
Absolutely. And with providers like you, myself, I mean, there's thousands of providers out there that are now providing this service and getting results. The more and more people that experience it, got a good result, that's going to further kind of snowball into this effect to where they're telling their friends, family about telehealth and the results they got. And that's going to slowly help that transition. I guess I'll take away slowly. It'll quickly help that transition. So that's kind of impetus on you and me and all the other providers to not only just provide online physical therapy, but provide good results, get the outcomes that we need and that we want our patients to have. And that's further just going to help the progression towards utilizing the service going forward and for the vast majority of individuals.
I think we're quite honestly going to laugh, 5-10 years down the road, that it took us this long to offer this style of physical therapy. I think we're honestly going to laugh at ourselves that we didn't jump on board sooner. Now, hindsight's always 20/20, but I think it takes people like you and I who see the immense value to this and to show it to people and to bring it up to speed, to prove that this is just as viable as other styles of physical therapy. So I think, the balance is gonna swing into the opposite direction there, and we'll think back to ourselves like, wow, I can't believe we didn't see that it was going to go online. I mean, the rest of the world is going online. How did we think somehow that we were impervious to being somehow transitioned into an e-space? I don't see how we are incapable of getting there.
Absolutely. I'm excited for that transition, especially knowing that people like you are out there also doing this, because then I know the people that come in contact with you are going to be getting the outcomes and the care that they actually are looking for and they deserve. And speaking of that, you said you're in California. Which area are you in again? And then do you have any plans on kind of branching out outside of California? Because we haven't even touched on the benefit of telehealth as far as where can people be to receive it?
Yeah, so right now I'm located in Northern California, just north of San Francisco. But with online, I can reach anyone in California. But I think what you might be alluding to is physical therapy's push towards developing, compacts or agreements with other states that allow you to treat across state borders. And I know they're working on that. California's always, California and New York love to be tricky states, and they
Is
love
California not
to.
in the compact?
I'll have to double check. I can't give you a clear answer on that right now. I remember the last time I looked it up that it. I don't think it was fully resolved whether or not California was on. So I'll look at that and hopefully give you an answer later. But as of right now, really limited to treating within the state, but soon, if not already now, you'll be able to extend. I'll be able to extend my reach beyond just the California border and address other states that have high skiing populations like Utah, Colorado, Montana, Idaho, right? All those areas where there tends to be a slower approach towards or a slower adoption of these newer models of healthcare, like online physical therapy, right? I think even more so, the people in those areas are gonna clamor for a service like this, and I would love to see it be able to extend any skier in any region of the United States.
Absolutely. And just to kind of clarify that, just for some people that may end up watching this that aren't clear. So you can technically, you are up in Marin, but through the telehealth platform, you can literally see anybody in the entire state of California, all the way down to San Diego and even further north from Marin where you're at. As long as they're in the California state border, they have access to you and your services. So people that are skiing Big Bear can even contact
Absolutely.
you. Yeah.
Absolutely. Yeah. I'd say probably my clientele right now is equally divvied up between Northern and Southern California,
Oh, great.
between San Francisco and LA. And it's awesome. I love the ability to reach greater than just what is geographically within the marketing radius of my clinic. That I work part-time at, and I really enjoy more of the outreach that I have with online physical therapy. I feel like I can address anyone if I just if I put it out there in the right way and people are willing to listen. I feel like I can reach anyone in California, which is so powerful.
It's so fascinating. It's a really cool concept, and luckily here in Utah we are part of that compact. So right now I'm only licensed in Utah, so I can see anybody in the state of Utah just like you can with your state of California. But very soon I'm going to renew my license in Colorado and then consider the other areas within the compact state to, again, address being able to go across state lines. I mean, we've been talking about all the advantages of telehealth for the individual that may be receiving it, but for us as the provider, it now removes the barriers of physical location and being able to dramatically increase our reach across state lines to reach the people that are looking for solutions. I'm really excited about the ability to dip into the Colorado population, Montana, like you said, all those Western states, and quite honestly, all the Eastern, but any state that you have a license in, you can provide telehealth services to, and having the ability to not only remove the barrier from the client, but remove the barrier from me as the clinician of, are you within a 20-mile radius? Now it doesn't matter. Now location is honestly it's just a blip on, like you're just a point on the map, but that doesn't matter. If you have internet, we got you.
And I think one thing we haven't brought up yet is that, we're referring right now to breaking down the barrier between the clinician and the person, right? So I could reach someone who's anywhere in the state of California, but that person doesn't have to stay in doesn't have to stay in that specific part of California to receive treatment. So say they travel somewhere, say someone in LA who's skiing wants to come to Tahoe and ski and they injure themselves. Well, guess what? They don't have to wait till they get back down to Southern California to see their therapist regarding their injury. They can reach out to me immediately, and it can still and can be seen. It can be treated right then and there. So you've eliminated, or
Seamless.
you've cut down drastically on the waiting time people have before they get in front of a clinician. And we all know that the sooner you can be seen, the quicker the outcomes. So
Absolutely. I mean,
not
how
only
many
does
times have you heard of an athlete or a family member or somebody that gets hurt when they're on a trip somewhere and they're like, oh, I can't wait till I get back into X city to talk to my provider? Not anymore.
yeah,
Just call up Ben or call up Russ or call up whoever, and they can treat you while you're still on the vacation or screen you while you're still up. Like you said, if they're up in Tahoe, you can do a screen on the computer before they even go down to LA.
I think right now it seems like, we deliver to people who are at home because people are quarantined right now. So there's a little bit of, tunnel focus, a little bit myopic viewpoint on where people have to be, right? They don't have to be at their home. They can be anywhere within the state in which I'm licensed, in which you're licensed. And like you said, in the state of Utah, that extends well beyond just where you are and where they are. They can be someone in Colorado and you can be in Utah doing it, which I think is so beautiful. Yeah, there's so many great benefits to it. I think from a therapist or clinician perspective, living once again in the Bay Area, a lot of people have the ability to have flexible work schedules,
Yep.
and that's something I have admired. And I'm now learning the great side benefits to this online is having a flexible work schedule, and that's so great as well.
It's critical.
Piggyback on what you were saying earlier about getting injured and then having the ability to see someone right away. Well, how great is it that it's the same person you have been seeing, right? The comfort you have with that therapist is still there. You don't have to find a new person. You don't have to rehash your old story, now
Yep.
your new story. It's all part of the same continuum, same plan of care. I think people really enjoy having some continuity, some things that don't change like that. They really appreciate that.
Yeah, it almost brings, like, the professional sport athletes always have their coaches, their physical therapists, and their consistent people that help them throughout their entire training. And every time they get hurt, they have the same providers around them. The more and more we discuss this, the advent of the telehealth and online physical therapy allows the average individual to almost have that same type of care, because now they can get that one-on-one care with their specific provider wherever they need it, when they need it. And if they get hurt here in Salt Lake City, they drive down to Bryan Head, wherever, they can still hop on a call with me, and it's like nothing ever changed. It's the same provider, same history. So it almost brings that professional feel to just anyone who is utilizing the service.
I love the on-demand nature of it. It's almost like Uber for physical therapy, right? You need something right away, it gets delivered to you. That sort of quick style of delivery, that sort of accessibility and ease. I love the on-demand nature of it. I think people find so much value in their prognosis, their confidence, their encouragement of their injury when they can be seen right away and can have their questions answered right away. There's so much value to that.
Absolutely. And Ben, I guarantee you and I could talk all day about this. And honestly, we're going to have to get on to another thing and kind of continue having talks like this, because I can just tell that by talking with each other, it creates more of the creative wheelhouse of how this can best be utilized to get the outcomes that we want and for our own personal endeavors. With that said, where can people find you?
So people can find me a lot of different places. So you can find me on my website at telephysiopt.com. You can find me on Instagram at telephysiopt. You can always reach out to me via email at drben, DRBEN, at telephysiopt.com. You can find me on Facebook and YouTube. You can find me, um, maybe I might even put my cell phone number down below at the bottom of this video. So I'll list all the things, I'll list all the ways in which people can find me here in this video. But
Awesome.
because we're an online, we always, people like you and I appreciate immediate response and the ability to get back to people really quickly. So, you can believe that if you reach out to me, I'll get back to you. I like to promise within 24 hours. So I hope I can deliver on that promise.
I
And
love
what about
that.
you, Russ? Where can people find you?
Yeah, so I'm most active on Instagram at Recalibrate PT. I'm also on Facebook with Recalibrate PT. And quite honestly, reach out to me through those two mediums. I have emails and all that, but if you're reaching out through Instagram and Facebook, you'll have a quicker response and you'll be able to see some of the good content that we're putting up there that can hopefully help people out.
Yeah, absolutely. Yeah, so
So
we should definitely get a chance to do this again because I feel like we're gonna get a lot of questions, a lot of great feedback from this, and we're really just scratched the surface of the benefits of online physical therapy. But man, I would love to get into different different injuries, different management styles, different conditions. Uh, Answering the questions that people have about online physical therapy. So I can't wait to do another one of these follow-up videos to provide the people with more education, more awareness. Because the more they have, the better decisions they'll make regarding their healthcare, and the happier that makes me, even if I don't even get the chance to work with them.
absolutely. Yeah, I'm excited to see where this goes.